Hello, I'm Nick the Nurse. Today we're going to be talking about some of the nursing diagnoses that are associated with coronary artery disease. Now, again, whenever we're thinking about nursing diagnoses, we want to try to get in the mind of both the patient and how they're feeling and what they might be thinking, as well as what the nurse is going to need to do in order to help the patient get through what they need to get through to either progress or cure the disease or whatever it is that they need to do to get complete and whole again, right? That's why we put patients on care plans to help them what? Help them improve. So one of the big nursing diagnoses that you need to associate with coronary artery disease is impaired gas exchange. Why? Because when we talked about this, when we talked about some of the signs and symptoms and some of the causes, when you have coronary artery disease, you're going to have either clogged or really stiff, not very elastic vessels that are coming out of the coronary artery. Now, the coronary artery is responsible for oxygenation of the heart and for the rest of the body to a certain extent. So we want to make sure that we have good tissue perfusion. We want to make sure that the patient is well oxygenated and that they're getting everything they need to get to that point. So keep that in mind when doing care plans. Additionally, we talked about acute pain being a sign or symptom. The patient might have angina. So when we're formulating our care plan for a patient who has coronary artery disease, we want to address pain. You want to make sure that you include everything in ADPI, okay? Activity intolerance. The patient who has coronary artery disease might be tired because their heart isn't pumping as efficiently as it should. And you also might have impaired gas exchange coming into that, and that's just going to make them even more tired. Ineffective tissue perfusion is another nursing diagnosis that should always be at the forefront when addressing a patient who has coronary artery disease. So if they have ineffective tissue perfusion, they've got cold extremities or they have either absent or weak peripheral pulses, that's something that the nurse must address in their care plan, on nursing school exams, and possibly even on the NCLEX if the issue comes up. So those are some of the nursing diagnoses associated with coronary artery disease. My name is Nick the Nurse. I want to thank you for watching my video today. If you'd like to check out any of my other videos, please check them out at www.nickthenurse.com. Thanks again for watching. I'll see you next time.